Hey guys, this is Dr. Hub. Now we look at the suggested norm. And this will be in case of the health workforce. So let's look at the health personnel and the norm suggested respectively. So doctor. So the doctor, the norm suggested is 1 per 1000 population. Then comes the health worker, that is a male and the female. So this will be 1 per 5000 in terms of the planes, and in terms of it will be 1 per 3000. This is in terms of the hilly areas. Next is the health assistant. This is the male and the female. This is going to be 1 per 30,000 in terms of plains, and 1 per 20,000. This is in terms of the hilly areas. Next comes the role of the pharmacist. The pharmacist is going to be 1 per 10k, and lab technician is also going to be 1 per 10k, and the auxiliary nurse midwife this is also going to be 1 per 10k. Now let's look at the urban social health activities. Urban social health activist. So the USHA. So this is going to be 1. It is 1 per 1000 to 2500. Next, we will look at the ASHA. ASHA is accredited social health activist. This will be 1 per 1000, and this is a village. Thus 200 to 500 households. Then there is also in terms of 1 per habitation. This is in terms of hilly areas or the remote areas. Next, we are going to look at the trained DICE. So, or the trained birth attendants. So here, this will be 1 per 1k, that is 1000 in a village. And looking at the village health guide, this is going to be 1 per 1000 again. Next, we are looking at the Anganwadi worker, AWW Anganwadi worker. This will be 1 per 400 to 800. It will be 1 per 400 to 800. This is in terms of the plains. Next, there is also 1 per 300 to 800, and this is going to be in terms of remote or the hilly areas. Next, we will look at the nurse. So nurse is going to be 1 per 5000. Then lastly, there is a Mahila Arogya Samiti. There is going to be Mahila Arogya Samiti. So this is going to be 1 per 250 to 500. So there is about 52 covers 50 to 100 households.